So here we have a 32 years old patient who's gonna go through FUE surgery. Between 2,500 to 3,000 to do the front. As you can see, most of the hair in the front are lost and miniaturized. Now that the shaving part is completed, we're gonna clean him up, disinfect the area, and start the numbing. So now he's gonna disinfect the area, then I'll inject 1 centimeter, and then we're gonna start the punching. This is the first punch. I usually like to do 10 punches to test the depth. I make sure that I'm not harvesting hair in a row, so I have a random pattern of extraction. I usually don't take more than 30% of the donor when doing FUE. It's a personal choice. It usually heal well and preserve donor for future procedure. As we all know that hair loss is a progressive condition and patients most likely may need more than 1 procedure in a lifetime. You can see there on the microscope, we have harvested some follicles. We have follicles of 2s, follicles of 3s, and 4. This patient doesn't have a lot of follicles of 1, so we're gonna have to produce them for the hairline design, but most of his follicles are 2, 3s, and 4. Now I have punched graft and I left most of the graft inside, so they're still connected to the blood flow, so it minimizes the time outside the body. Really what I want to insist is the distance between each punch compared to the number of follicles intact left in between. There is no linear punching or close-up punching, so it's really important to have a pattern of extraction. On purpose, I didn't shave the hair on top because I need the hair on top for the direction. So the sides are made following a triangular pattern, making sure that they lay down less than 45 degrees angle. Important not to have a straight line when we're designing the hairline. That is not a straight line, but it has in and out. It's really crucial to hold it gently without squeezing it, without forcing the insertion. It's been placed. You can see it's not a straight line, it's a zigzag. And the recession here has been done also. But really it's important to have number of 2s, the number of 3s, especially number of 1. The singles on a hairline will give the naturalness of a normal hairline. The transition zone will give it the softness, and then the 3 hairs will really build the volume and the density.